How you know your child has a sleep problem is a very common concern. Not being able to tell how much sleep your child really needs, and if sleep is the cause of some problem your child is having. The general concept of sleep issues stands true for all age groups. Having trouble going to sleep, staying asleep, having some episodes in sleep that interrupt the continuity of sleep, and as a result, having trouble functioning as much as a person should be able to function during the day, are the common issues that are true for everyone, all age groups. However, the expectation of how much and how well a child needs to sleep changes very quickly and dramatically between newborns and teenagers over the 18 years or 20 years of a person's life. A newborn sleeps most of the time except for feeding times. A 1-year-old or a 2-year-old sleeps about half the time. About 12 to 13 hours they're awake, and they're sleeping for 12 to 13 hours. The commonest complaints I hear from parents relate to newborns and toddlers, and then about teenagers. Newborns and toddlers are felt to have problems with their sleep quite often when their pediatrician asks the question from the parents, how much does your child sleep? And the parents feel the child just does not sleep enough, and that creates a concern. So it's important to make sure you understand, for the newborns and infants and toddlers, you can't really make them sleep more. You can identify an issue of the child not sleeping long enough, and if something is interfering with their quality of sleep, but you don't medicate them and force them to sleep any longer than they are. So the concern that people ask you about in terms of how much does your child sleep and is the child sleeping long enough relates to any other problems with their body, with different organs, with different systems in the body functioning well. So it can raise a question as to what might be the cause of the child not sleeping long enough or well enough. But in a completely normal child, you can't force them to sleep any longer. The second concern that comes up is most often with children going through puberty, which the age group can be quite variable between girls and boys, and depending on the family, the genetics, a lot of other factors. But this can include children between 10 or 11 years of age and up to 18 or even 20 years of age. As a child goes through puberty, their need for sleep dramatically increases. And parents are often concerned that their child is needing too much sleep, or they're tired and sleepy during the day after sleeping for what they think should be an adequate amount of time. A teenager often needs 10 to 12 hours of sleep, and that becomes a challenge considering their demands at school and their social life, and they're wanting to stay up later at night while having to attend school in the morning. So there are a lot of factors and a lot of variability in how much a child needs to sleep and what this can show up as. Now, other common problems that children have to do with different kinds of episodes happening while they're sleeping. Younger kids will often wake up in the middle of the night and come to the parents' bed And the easiest way of figuring out if this is truly due to a problem or not is to be able to say if they sleep well in the bed with you as compared to sleeping on their own, because that will tell you that it's the anxiety of being away from the parent that's affecting them. The other problem that children often have has to do with sleepwalking or sleep talking, moving a lot during sleep, kicking, and different kinds of episodes that happen, suddenly sitting up, seeming like they're awake, waking up crying, or not seeming to wake up, but having episodes of abrupt crying, which are often termed as sleep or night terrors. So what I'm trying to explain to you is the expectations of how much a child needs to sleep and how well they're supposed to sleep have to be correct. And you have to educate yourself on, as a parent, on what truly is the amount and kind of sleep that your child needs.